innovation. Here are just 5 that might surprise you. We created the modern randomized controlled trial. In 1948, while working on tuberculosis, our very own Professor Austin Bradford Hill introduced the randomized control trial to health research for the first time. This is now the gold standard of trial design, used by scientists around the world to make fair comparisons between treatments. We proved the link between smoking and lung cancer. In 1950, Professors Richard Dole and Austin Bradford Hill published an early study connecting smoking with lung cancer. They went on to study the smoking habits of 40,000 doctors, providing important evidence that death rates from lung cancer and heart disease increased with the amount smoked. We're home to the inventor of exercise. In 1953, Professor Jerry Morris published a famous study comparing heart disease between bus conductors and bus drivers. It showed that sedentary bus drivers had much higher rates of heart disease than the more active conductors. This was the first evidence demonstrating the important connection between exercise and health. So you can thank Jerry for those trips to the gym. We showed that bed nets treated with insecticide could stop millions of children dying from malaria. Since the 1980s, our experts have helped develop, test and roll out insecticide-treated bed nets to people living in regions with malaria. We proved these nets could prevent millions of deaths and a great value for money. Now, over half the population of sub-Saharan Africa sleep under them. Their use has played a major part in halving malaria deaths over the past 20 years. We brought newborn deaths and stillbirths onto the global agenda. In 2005, we published the first national estimates on the causes of newborn deaths and the numbers of stillbirths around the world. 99% of the 8 million deaths each year were in low and middle income countries, yet were invisible on the global and political agendas. Thanks to ongoing work, targets for preventing these deaths are now included in the UN's Sustainable Development Goals, and innovations in communities and hospitals are saving babies' lives daily. Here's to another 120 years of health innovation.
Founded in 1899 at the Royal Albert Docks, the London School of Hygiene and Tropical Medicine moved to its new building on Keppel Street in 1929. At the time of the construction, a mysterious committee chose the name of 23 scientists, from microbiologist Louis Pasteur
إله إلا الله عزيز رسول الله صلاة وسلام نبينا يا ربي تفوح عليك لا إله إلا الله لا إله إلا الله لا إله إلا الله لا إله إلا الله العزيز رسول الله صلاة وسلام نبينا يا ربي تفوح علينا صلاة بنا يا ربي تبو علينا لا إله إلا الله العزيز رسول الله 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 لا إله إلا الله لا إله إلا الله لا إله إلا الله لا إله إلا الله العزيز رسول الله صلاة بنا يا ربي تبو علينا بنا يا ربي تبو علينا Thank you. Thank you. Thank you.
Thank you. Good afternoon and welcome to Friends House for the London School of Hygiene and Tropical Medicine's graduation ceremony 2020. The ceremony will begin very shortly, so could you please all take your seats? Please ensure that all mobile phones and other electronic devices are turned to silent. Graduands, please ensure that you are sitting in the seat assigned to you. You will find your seat number on the ticket you received when you registered. If you are not sitting in the correct seat, this may disrupt proceedings. We aren't expecting any problems, but if for any reason we need you to evacuate the venue, an alarm will sound and event staff will direct you through the exit doors to a safe space. Please do have a look around you now to familiarise yourself with the emergency exits, as there are a number around the room. You will notice that there are some video cameras around the room. This is because the ceremony is being streamed live and will be available for download afterwards. Please also be aware that flash photography will be taking place and being used as each graduand crosses the stage. Do feel free to take photographs and videos during the ceremony. However, please be careful not to obscure the view of those around you. Finally, today is a celebration of the success of our graduands. So please do enjoy the afternoon and show your support with applause and maybe even a little cheer. Thank you. Ladies and gentlemen, could you please be upstanding for the academic procession?
Please be seated. Good afternoon, ladies and gentlemen, and welcome to the London School of Hygiene and Tropical Medicine's graduation ceremony 2020. This is the second of two ceremonies today, and it's wonderful to see such a large number of family and friends here to celebrate our graduates' achievements. I would like to invite Professor Peter Piot, Director of the London School of Hygiene and Tropical Medicine, to the lectern to say a few words. Professor Piot.
Thank you, Professor Mills and Chairman and honored graduates and guests. It's really a privilege for me as Director of the London School of Hygiene and Tropical Medicine to welcome you here to this graduation ceremony. This is, of course, a memorable day for us, for you graduates, but also for the life in our school. Especially because this year marks the 120th anniversary of our school, 120 years of being at the forefront of policy change and fighting epidemics and health inequity, of training practitioners and leaders in public and global health, and of innovative research to find solutions and develop new tools to improve health and well-being in the UK and globally. We had a great celebration in September with some of our illustrious alumni, such as the Director General of WHO, the head of the Health Population Nutrition at the World Bank, regional directors of WHO, all alumni. And we added 3 women to the 12, I think, men who are on our frieze in Keppel Street to re-establish some historic injustice. There is no more dramatic illustration that health is both local and global than the current outbreak of COVID-19, the unfortunate name for this coronavirus outbreak that started in Wuhan in China. Local because ultimately it's at the community level that people's health and lives are shaped. But global because in today's world, both infectious diseases outbreaks and political and economic forces have global impacts and local impacts. Our scientists are actively involved in the response to the corona outbreak, just as they are with the ongoing Ebola outbreak in Central Africa, in Democratic Republic of Congo, including here in the UK, in Asia, and in Africa. And we will soon launch a MOOC on coronaviruses that I hope will be very popular. Now, the global nature of our school is also reflected in our staff, students, alumni, and in the focus of our research. And when I use the word global, I mean here and elsewhere, not just international or low and middle income countries. At a time when some of the world seems to be increasingly turning inwards, we remain resolutely committed to tackling the most pressing health challenges, both here in the UK and around the world. We also face countless other global challenges. More displaced people and refugees than ever before in history, prolonged conflicts and humanitarian crises, the potential rebound of the HIV epidemic amidst growing complacency, drug-resistant infections, spikes in preventable diseases like measles due to powerful anti-vaccine movements, and a tsunami of non-communicable diseases such as cancers, diabetes, heart disease, and dementia facing societies, rich and poor, all over the world. All of this is set against the backdrop of climate change, shrinking space for civil society, diminishing natural resources, and the demographic implications that come with longer life expectancies. At the same time, we should not fall into the classic trap of public health academics and only see the problems and only see the bad things. Historically, we've never had it so good in terms of health, living longer, more than ever, and with better quality of life. But the challenges we have will continue to have major impacts on all of our lives, but even more so for you graduates, as you embark on the next stages of your career. So the world really needs you. The benefits of your education also bring responsibilities in these turbulent times. As the next generation of public health leaders and scientists, you will undoubtedly be working towards the solutions, and your knowledge, values, and creativity will be critical in shaping these. And in addition, and as compared to when I was your age, you will have access to unprecedented technologies. Some of the potential is not yet clear at all. And that gives me reason for hope, and is why I remain an optimist. I also hope that we are at a new dawn in public health, where we shift how we practice medicine and healthcare, move away from very expensive firefighting to stopping people from getting ill in the first place. We are also just at the very early stages of realizing the enormous potential that technological innovations such as machine learning and artificial intelligence can have on our work and our day-to-day lives. It's already there. And that's why we're launching in October this year our first Masters in Health Data Science, to create a new generation of scientists, of practitioners who understand fully the potential of technology, but also understand fully what it takes to improve health. Technological innovation offers real potential for so-called leapfrogging in resource-poor settings, particularly to at least partly overcome major deficits in human resources and to better reach those in greatest need. At the same time, the wake-up call led by young people all over the world to urgently address the accelerating impact of climate change now gives me hope. It's probably the best news of last year. And that's also why we launched last year our latest center, the Center on Climate Change and Planetary Health. Bring together researchers from different backgrounds to find critical solutions to the immense health challenges brought about by climate and environmental change. Now, as you embark on your careers, be prepared that it won't always be a straightforward trajectory. The idea that you can plan a secure career in these uncertain times is an illusion, and has always been an illusion. And speaking from my own experience, I would suggest that you don't overplan, as you can end up missing opportunities along the way, and life will be more boring. I hope one of the things you have learned here is to always look ahead and to prepare, while recognizing that life is always going to surprise us. So carry on learning and don't be afraid to take chances. I hope that you agree that your success here owes something to the support of your families, friends, partners, and also to the dedication and skills of our valued staff, many of whom are in the audience today. I would also like to thank each of you graduates for the important contributions that you've already made to the life of our school. In addition to the things that you've learned in our classrooms, and indeed have taught us, you've probably learned just as much from your fellow classmates. And what I hear when I meet with alumni is that your classmates have also become part of your cherished personal and professional networks that you can continue to lean on and learn from in the future. As I mentioned, I regularly meet with alumni all over the world, wherever I go, and the most common thing I hear is, "This was the best year in my life." I mean, studying at LSHTM. Let it also be the year that you built a lifelong link to our school and to each other to join forces to improve health worldwide. From today, you join a family of alumni, a few tens of thousands of alumni working in over 180 countries, but united by a common mission and a common experience. We look forward to keeping in touch with you as your careers evolve, and we also look to you to support the school as we develop our research partnerships and educate future generations of students at a critical time for global health. Congratulations to everyone, and my very best wishes for whatever comes next. Thank you.
Many thanks, Professor Piot. It is now my pleasure to introduce Professor Cara Hansen to deliver a citation for the 2020 Edwin Chadwick medalists, Professor Charlotte Watts and Dr. Claudia Garcia Moreno. Professor Hansen.
So, Sir Edwin Chadwick was one of the founders of modern public health. He was a scientist and a public health campaigner. He understood the power of empirical evidence in drawing attention to the impoverishing effects of disease, the importance of intervening at the system level to improve access to clean water and sanitation, and the need for advocacy as a means of securing change. I can think of no more worthy recipients of the award that honors him than Dr. Claudia Garcia Moreno and Professor Charlotte Watts. Professor Watts and Dr. Garcia Moreno are widely recognized as global experts on violence against women and health. Their work has been instrumental in building a field of research on this important topic and drawing the world's attention to violence against women as a public health issue. Dr. Garcia Moreno organized the first ever WHO expert meeting on violence against women. The meeting recommended that there should be a scientifically robust epidemiological study, like the sorts of things we learn to do here, on violence against women, and they wanted to study the prevalence and the health impact. With Professor Watts as Senior Technical Advisor, she led the landmark WHO multi-country study on women's health and domestic violence. Together they conceived, designed, and coordinated the study, creating international and national partnerships and groundbreaking methods to identify how best to approach and collect data in an ethically responsible way. The study interviewed more than 24,000 women in 10 countries about their experiences of violence and was the very first to provide comparable data on the prevalence of violence against women across a range of geographically and culturally diverse settings. The study methods and the ethical and safety recommendations for doing this kind of research remain to this day the gold standard, and the study methodology has now been used in national surveys in more than 37 countries. Following the multi-country study, Professor Watts and Dr. Garcia Moreno co-chaired the Global Burden of Disease Expert Working Group to assess the global burden of intimate partner violence and sexual violence, leading to the first global and regional estimates of prevalence, which concluded that across the world, 1 in 3 ever-partnered women will experience physical and or sexual violence from a partner, or sexual violence from other men in during their lifetime, and that these exposures have substantial public health impacts. Professor Watts carried on this program of work to play a significant role in demonstrating that domestic violence is preventable, so moving from measurement to intervention. She's been senior researcher on 5 cluster randomized controlled trials in sub-Saharan Africa that have assessed the impact of different models of violence prevention and has led to an increased focus on violence prevention globally and stimulated large-scale investments by major donors, including the UK government. In her current role as Chief Scientific Advisor to the UK Department for International Development, Professor Watts has continued to demonstrate strong leadership in tackling issues of gender equality and women's empowerment. Through their collaborative research in producing high-quality evidence about the burden of violence against women, the effectiveness of interventions to address it, and following this with advocacy at the national and global level for programs and policies to prevent violence, Dr. Garcia Moreno and Professor Watts have transformed the field of violence against women and health. We are delighted to have you join us here at graduation, Claudia and Charlotte, to celebrate your contributions and as role models for our students. Mr. John O'Donnell, I call on you to confer the Edwin Chadwick Medal upon Professor Charlotte Watts and Dr. Claudia Garcia Moreno.
Well, after all of that, what do I say? So John, Peter, Anne, Cara, London School colleagues, graduands, and all of your proud family and friends, I really must say it's a great pleasure and really a true honour to receive the Edwin Chadwick Medal. Along with my long-term collaborator, friend, and partner in arms, Claudia Garcia Moreno. I feel particularly privileged to be given this medal because Chadwick, as Cara said, pioneered the use of scientific surveys to expose important but neglected social issues. In the 19th century, he designed surveys to expose the dreadful conditions that working-class labourers were living in and really used those findings to push for public health improvements. And I think there's a real parallel that the work that Claudia and I have done together over the past 20 years. It's been 20 years that we've been working together. In the early days, really trying to figure out how do we measure, how do we understand the scale of violence that women experienced. And at that point, and it's hard to think back at that time now, we were in the Me Too movement, at that point it was an issue that was hidden and commonly trivialized. We worked together to figure out how to conduct population surveys in many different countries that capture women's real experience of violence, but doing it in a way that didn't re-victimize or stigmatize respondents, but instead tried to empower women by telling them that they were not alone and what they were experiencing was not acceptable. This and the work of many others as Cara said, uncovered the unpleasant reality that 1 in 3 women globally will experience physical or sexual violence in their lifetime. And subsequently, I've been proud to work with colleagues in the Gender Violence and Health Centre here at the London School of Hygiene and Tropical Medicine to show that violence is preventable. So it's not necessarily a bad story in terms of this is something that's widespread, but but we can't do anything. What we know is that we can intervene, and actually those interventions can have major impacts. So another aspect of Edwin Chadwick's life that resonates with me is that he switched disciplines. He started off in law, but went on to dedicate his life to public health. And I've also had a bit of a non-linear pathway, as Peter says, is what we should be open to doing. I started my academic career as a mathematician, but ended up working on violence against women. Now, this isn't an obvious career trajectory, and was the choices that I made often by listening to my heart versus my head. And at times I took risks and chose to tackle and lean into very difficult issues because it felt that they were important and they were right, and it was the right thing to do. So, as you embark on your future careers, I would similarly encourage you to follow your heart at times, because even though this might not be the easiest or the most obvious path, I also hope that we'll follow in Chadwick's footsteps and use the training, skills, and networks that you've built up during your time here at the London School to go out and make a difference. As Peter just said, the world needs you. Thank you.
Dear colleagues, Peter and friends and family, this is a little bit more emotional than I had foreseen. But I'll just say first that it's a real pleasure to be here. I owe many things to the London School of Hygiene and Tropical Medicine, over and above this medal. First of all, coming from Mexico to do my master's here, I was once where you are now, and it totally changed my life. It opened new doors and led me into a career that I would never have imagined back home. I survived my first London winter, and this was pre-climate change winter. And I learned, as Peter said, so much, not just from the lectures in the library, but also from being with other people from different countries and hearing about experiences from other countries. And it led to a job, my first public health job with Oxfam, which allowed me to get my teeth into primary health care, HIV/AIDS, and eventually women's health, and the work on violence against women. And in that process, I also learned how many forms of discrimination come together with poverty to impact people's health, and in particular, how gender discrimination impacted on women's health. And that is another thing that I owe to the London School, which also Peter mentioned, which is the friendships and my first women's group. And I'm delighted to share with you that in about a month's time, some of us are coming together from different parts of the world to share over 30 years of friendship that started here at the Masters. So this is really a long-lasting, thing that I owe to the London School. And now coming to the Edwin Chadwick Medal, I'm really, really grateful for the honor and really appreciate the recognition because, as Charlotte said, perhaps more discreetly than I will, it has not always been an easy journey. It's been a bumpy journey and at times quite tough. We have had some fights, small and big, and it's been really required, I think, some perseverance and long-term vision to be able to put violence against women on the global public health agenda in the way that it is now. And I'll just mention 3 things that I think have been critical. The first is research, and has already been mentioned by Cara that the skills that we learned here were really important. And having the numbers combined with the human stories was critical to convincing the skeptics and to making the case. And then initially just on describing the problem, and then, as has been said already, to look at interventions. What works? What do women want from services? How to make the system, the health system be able to deliver the kind of care that is safe and effective and that is survivor-centered. And so from descriptive epidemiology to evaluations to interventions research to implementation research, this has really been important to building the field, and all the skills that you have learned in your master's will be put to good use to whatever cause you decide to pursue. Secondly, the importance of partnerships. Partnerships at the personal, at the professional, and at the institutional level. What started out as a professional relationship between me and Charlotte evolved to a friendship that also helped to cement the professional relationships, because these work best when there is trust, when there is confidence that we will have each other's back, and that's how it's been for all these years. And at the institutional level, the partnership between an institution like the London School with its scientific and academic perspective with an institution like WHO with its ability to influence policies and programs has also been very valuable in allowing us to move from the research into the program, into the policy change, and into the concrete work at the country level. And the third thing that I think has been very valuable in this journey is the mentoring and building of the next generation of researchers. I was giving a lecture at the short course on violence and research that is now given on a regular basis at the school. And it was really, really heartening to see so many young men and women, scientists, future researchers interested in the topic. And I think this would not have been possible without the work that we and many others have done throughout these years. So thank you. Thank you to the London School. Thank you to those who nominated us and for this recognition, and on to the next stage of addressing this huge problem that we still have of violence against women. Thank you.
Thank you very much to both of you for your inspiring speeches. The medals were awarded in recognition of your amazing contribution to violence, to addressing the problem of violence against women. But Claudia reminded us that she is in fact an alumnus, and in fact Charlotte didn't mention that, but actually in her journey from a mathematician to her current expertise, we met when she was thinking of studying at the school, so she also is an alumnus of the school's programs. So you may see these as models for you in your future careers. So, Mr. John O'Donnell, we come now to the presentation of the afternoon's graduates. On behalf of Council, the governing body of the London School of Hygiene and Tropical Medicine, we invite you to formally recognise and celebrate the academic achievements of its students. Representatives from each faculty will present to you the master's degree and research degree students who qualified degree in the academic session 2018-19. I call upon Professor Cara Hansen to come forward and present the master's degree graduates from the Faculty of Public Health and Policy. Professor Hansen.
Thank you very much. So good afternoon again. It is my pleasure to introduce the graduates from the Faculty of Public Health and Policy. I'm going to start with the award of the Master of Science in Public Health. I'm going to start first with our prize winners. So our first recipient is Alice Rosemary Godman, who is the winner of the Zoe Walker Memorial Prize. And Anubhav Nangia, who is the winner of the Chadwick and Daly Prize and who received his degree with distinction. Olivia Ashmore, who received her award with distinction. Chloe Antonia Christabel Byers, also with distinction. Emily Natalia Shyama Finch, also with distinction. Anne Katharina Christiane Geweniger, also with distinction. Emily Jane Humphreys with distinction. Alexandra Levitas with distinction. Eleanor Sarah Marsh with distinction. Anisha Soni with distinction. Madeline Morton Whalen with distinction. And Maya Emma Whitaker with distinction. Isabel Margaret Fiona Abbs. Crispin William Acton. Felicity Mary Annandale Ayano. Mami Nkansa Asamoah Amoa Kohene. Laurencia Ma Azas. Anamika Basu. Kirsty Leanne Bell. Victoria Alice Edita Branton. Jessica Brock. Elizabeth Riva Bullman. Rory Alistair Cameron. Christina Ciroli. Lakshmi Chandrasekaran. Ada Cheng. Joel Chilaka. Mihei Chung. Megan Coe. Enes Talia Maria Corcuera Hotz. Ana Cuadrado Conde. Kim Tuyen Dangova. Jeremy Carl Dietz. Aso Dizei. Isaac Florence. Victoria von Zalmeth. Laura Giordano. Rushella Giri. Hannah Yurtsen. Venetia Goodhart. Sophie Frederica Green. Ayana Griffith. Radhika Rani Gulati. Jessica Louise Gutman. Lewis Hall. Ahmed Ibrahim Hassan. Nicola Rachel Hawes. Avani Hegde. Rosanna Ruth Hildersley. Margaret K. Ho. Molly Bethan Hogan. David Mark Humphreys. Anaga Joshi. Kazuaki Kanamitsu. Kizinga Kieta. Did you get the picture? Christelle Naomi Elizabeth King. Victoria Amanda Kirkby. Stephanie Chiwai Kong. Sabiha Ladak. Alessandra Ledoux. Isabel Lucy Harrison Lee. Christina Elizabeth Lewis. Zara Liu. Madeline Leongson. Krista McKenna Luzinski. Jonathan Frederick Ulatunji Macaulay. Miwa Matthias Balil. Victoria Alba Malik Pasha. Lakshmi Manoharan. Ivy Masinde. Sarah Felicity Metcalf. Judith Moran. Marquette Dewey Moore Jr. Alicia Morton. Gadir Mukbul. Surav Nioji. Sally Elizabeth O'Brien. Lucy Grace Osborne. Yusuf Oskrochi. Alexander Edward Owens. Afua Boatema Usu. Mark Rohan Pakianathan. Paul Dain Park. Nicole Marguerite Peavy. Cleo Sonia Lakshmi Monder Pillay. Anna Quast. Sabrina Yasmin Raphael. Paul Gerard Reedy. Jenna Catherine Rhodes. Christina Santana Smith. Aditi Sitija. Petra Schoenweger. Kirsten Sell. Hillary Francis Smith. Chloe May Snowden. Diksha Srivastava. Arun Thiagarajan. Dara Shrikovnaya. Katharina Elsa van Evek. Vuli Vahid. Octavia Alexandra Wilkes. Dina Muhammad Saleh Ali Yusuf. Okay, did you all know your friends had so many middle names? So I'm going to move now on to the award of Master of Science in Public Health by Distance Learning, starting again with our distinctions and prize winners. Helen Mary O'Brien wins the University of London 150th Anniversary Prize and was awarded the degree with distinction. And Elizaveta Lebedeva, also awarded with distinction. Semakula Abba. Oh, sorry. Muhammad Samir Ali Abu Elanan. Mazen Al-Hebshi. No. Aoki. Ettore Ardimento. Anu Aurora. Saba Aslam? No. Francisca Badenshire. Fabienne Yvonne Marie Benoist. Subhajit Bhattacharjee. Andrew James Brett. Christopher Carvalho. Not Nicola. Nicola Saverio Centimero. Jolyn Chui. Catherine Francis Cowell. Catharina da Silva Lopez. Rana Dahab. Diederik de Savoren Lohman. Johannes Niklas Deinhard Diers. Mary Frances Hare. Anne Catherine Klan. Andrea Kleber. Sophia Kohler. Suzette Lee. Chun Pong Lung. Annie Yvette Liad Liad. Gwynezashe or Brittany? Brittany. Brittany Eileen Marriott. Congratulations. Julian Perez Ronco. Isabel Savard. Reem Ali Mohammed Sharaf Al-Din. George Sims. Natalina Sutton. Victoria Ann Thickett. And Beauty Maxwell Tobin. For the award of Master of Science in Health Policy, Planning and Financing, Sham Lamba, awarded with distinction. Shopitha Sivaranjan, also awarded with distinction. And Richard Thomas Tran, also with distinction. Olaitan Ator. Amal Ferouz Adan. Camille Bou. Bangan Brim. Simon Dries. Gina Kim. Samantha Therese Law. Catherine Jane Meyer. Joy Oyena Turuchi Nwizu. David Chijoke Obasi. Moira Teresa Riley. Lauren Mary Short. Hannah Uwakwe Mangse. And Maya Yassin. There are a few extras. Okay. Also for health policy planning and financing, Adelphine Mojoyan Adebajo. So now I'm going to move on to the award of Master of Science in Public Health in the Environment and Health stream by distance learning. Tui Swinnon. For the award of Master of Science in Public Health in the Health Promotion stream by distance learning, Meira Crean. Caitlin Ruth Leonard. Regina Geraldine Macwinja. Tanya Ruiz Toledo. And Anshe Chouette. Now for the award of Master of Science in Public Health, Health Services Management stream by distance learning, Nina Mittori. Simone Mello Atherton. Nadia Español Rochina. Beverly Ung. Ahmed Ramadan Shokri Shahat. Nadia Tekal. Kashif Wahid. And now for the award of Master of Science in Global Health Policy by distance learning. Ioana Maraki, who is the winner of the University of London 150th Anniversary Prize with distinction. Catherine Penelope McGowan, also with distinction. Kirsten Lynette Patrick with distinction. Sarah Barragan Montes. Anna Carter. Zhe Chao. Jorge Baruch Diaz Ramirez. Damien Joseph Duppy. Ramiro Eugenio Gilardino. Alisa Beth Kachikis. Alia Amirali Madani. For the award of Masters in Public Health by distance learning, David Mbota Sabai. And for the award of MSc Public Health in Health Services Management, Andrea Shefulbine with distinction.
Thank you, Professor Hanson, for the presentation of the awards for the Master's graduates from the Faculty of Public Health and Policy. I now call upon Professor Suzanne Filto to present the doctoral graduates from the Faculty of Epidemiology and Population Health. Professor Filto.
Good afternoon. It's now my pleasure to introduce the doctoral graduates from the Faculty of Epidemiology and Population Health, and starting with the prize winners. Sunil Bhopal, who's won the Cecily Williams Prize for his thesis on early childhood stress, adversity, growth, and development, findings from the Spring Home Visits Cluster Randomized Controlled Trial in rural India. Alyssa Madeline Preece, who's won the Jerry Morris Prize for her thesis entitled Snacks and Nutrition During the Complementary Feeding Period, a cross-sectional study among children 12 to 23 months of age in Kathmandu Valley, Nepal. Now, Eamon Alawadi, for her thesis entitled Population-Based Cancer Survival in Kuwait. Lucas Alexandrovich, for his thesis Impact of Dietary Shifts in India on Greenhouse Gas Emissions, Land Use, Water Use, and Food Expenditure, a nationally representative study. Amit Ba, for a thesis, a double-blind randomized controlled trial comparing standard dose of iron supplementation for pregnant women with 2 screen and treat approaches using hepcidin as a biomarker for ready and safe to receive iron. Sarah Benitez Maxamo, exploring age inequalities in the management and survival of colorectal cancer patients. Laura Jessica Brown, for her thesis Understanding Socioeconomic Disparities in Breastfeeding in the UK, exploring the role of environmental quality. Richard Matthew Clark, for his thesis, Vaccine Information-Seeking Behavior, is Predictors and Influence on Vaccination During Pregnancy. Felicity Clemens, for her thesis, Using Dynamic Path Analysis to Estimate a Mediation Effect through a Survival Variable. Marvin Gonzalez Quiroz, for his thesis, Occupational Kidney Disease Among Young Populations in Northwest Nicaragua. Selulakile Gamede, for her thesis, Evaluating Implementation of Revised Post-2010 World Health Organization Guidelines on Prevention of Mother-to-Child Transmission of HIV. Shona Horter, for her thesis, Investigating Experiences of Engagement with HIV Treat All Among People Living with HIV in Eswatini. Laurent Baptiste, for his thesis, Cost-Effectiveness Analysis with Informative Missing Data, Tools and Strategies. Jacqueline Lim, for her thesis, Undocumented Burden of Dengue in Africa. Shami Luhar for his thesis, Socioeconomic Patterning of Overweight and Obesity and Forecasted Diabetes Prevalence in India. Kate Mason for her thesis, Where and for Whom Does the Neighborhood Built Environment Matter for Obesity and Health? Examining sources of effect heterogeneity at multiple scales in the UK adult population. Anthony Matthews for his thesis, Adjuvant Endocrine Therapy Use in Female Breast Cancer Survivals and the Risk of Cardiovascular Disease. Ona McCarthy for her thesis, Changing Young People's Attitudes Toward Effective Contraception Using Mobile Phone Messaging. Francis Nissen for his thesis, Asthma and Electronic Health Records, Validity and Phenotyping. Shefali Oza for her thesis, Use of Statistical Models to Estimate the Timing and Causes of Neonatal Deaths. Anne Reramoy for her thesis, Development and Assessment of Systems for Population-Based Estimation of Neonatal and Perinatal Mortality in Gambia. William Rudgard for his thesis, Preventing Household Financial Hardship from Severe Illness, the Role of Cash Transfers in Brazil. Emma Kathleen Wilson for thesis, Evaluation of an Internet-accessed STI Testing and Results Service in 2 London boroughs. Kerry Wong for her thesis, Too Poor or Too Far? Partitioning the Variability in Hospital Birth by Poverty and Travel Time in 4 sub-Saharan countries. And Sachio Yoshida for her thesis, Evaluation of the Chinri Process for Setting Health Research Priorities. Which was this one? Okay, and for Miko von Konen, but that's, I'm not sure I'm reading this right. Postgraduate diploma in global health policy. All right, thanks. And this? Lekia Lesor Ndwide for an MSc in global health policy. Oh, God. And I'm afraid I'm going to mess this. Okenefejiro Unyonyo Chinwe Nwoko for an MSc in global health policy. And that concludes the awards to the doctoral and some MSc graduates in the Faculty of Epidemiology and Population Health.
Thank you, Professor Filto. I now call upon Professor Jane Webster to present the doctoral graduates from the Faculty of Infectious and Tropical Diseases. Professor Webster.
Good afternoon. It's now my pleasure to introduce the PhD graduates from the Faculty of Infectious and Tropical Diseases. I'm going to start with the prize winners. So first, Ankar Gupta Rate for his thesis, Investigating Mortality Risk in Hospitalized Patients in Africa with HIV-associated tuberculosis and positive urine diagnostics. He has the prize, the Woodruff Prize. Javira Nkurunungi for a thesis, Helminth Allergy Associations in Rural Urban Uganda, Insights from Antibody Studies, and he has the Garnham Prize. Helen Wagstaff, The Effect of Viral Vaccines on Natural Killer Cell Effector Function, the Garnham Prize. Sharif Abu El Hadid, investigating the biological role of N-linked glycans in bacteria. Lena Morgan Banks, investigating disability inclusion in social protection programs in low and middle income countries, with case studies from Vietnam and Nepal. Matthew Paul Gibbons, dissecting the CD8 positive T cell responses to pre-erythrocytic malaria antigens. Catherine Elizabeth Greenland, unpacking the black box, theory-based design and evaluation of a multiple behaviour change intervention to control childhood diarrheal disease. Matthias Jaroslaw Hasso-Agopsowicz, a study of factors underlying BCG immunogenicity differences across countries, the influence of DNA methylation patterns and antigen-presenting cells. Lou Salome Rose Tainer Herman, development of Plasmodium knowlesi species-specific reagents to help characterize antibody isotope profiles in endemic human populations. Sham Dharam Sen Lal, community case management and referral of children with fever within primary healthcare system in Uganda. Gurdeep Mann, exploring the potential of vaccination to combat Trypanosoma cruzi infection using bioluminescent imaging. Tegwen Marlais, diagnostics development for the neglected parasitic diseases strongyloidiasis and visceral leishmaniasis. Stephanie Jasmine Michelson, chlamydia trachomatis serology as a means of monitoring intervention activities to eliminate trachoma as a public health problem. Stephanie Diane Nofal, investigation of the role of GCA in activating cGMP signaling in Plasmodium and how cyclic nucleotide signaling modulates molecular motor functioning. Mapa Mudyansalega Prabhath Nishanta Piasena, a feasibility study to develop an integrated diabetic retinopathy screening program in the western province of Sri Lanka. Samuel Roy, there's a page missing. There's a page missing. these two. Lisa Stockdale. Let me say that again. Lisa Stockdale, investigation of immune correlates and impact of immune activation on tuberculosis disease risk. Lindsay Wu, navigating the immunoepidemiology of malaria, potential metrics for surveillance and cluster randomized trials. And that concludes the awards to PhD graduates from the Faculty of Infectious and Tropical Diseases.
Thank you, Professor Webster. I now call upon Professor John Cairns to present the doctoral graduates from the Faculty of Public Health and Policy. Professor Cairns.
Good afternoon. It's now my pleasure to introduce the PhD graduates from the Faculty of Public Health and Policy. And first of all, we have Samu Chisindi Luembe for a thesis, How has devolution affected the immunization program in Kenya? An ethnographic exploration of health systems. This year. Next, we have Florian Stiegler for his thesis, Preventing a Shortage of General Practitioners in Austria. Next, Donna Case Al-Abdul-Baki for her thesis, A Cultural Adaptation of a Diabetes Self-Management Program for Patients with Type 2 Diabetes Attending a Primary Healthcare Centre in Saudi Arabia. Next, we have Saba Bufked for her thesis, Labour Exploitation as a Social Determinant of Health, a structured conceptual framework focusing on migrants working in manual low-skilled jobs. Next, we have Pedur Matthias Clark for his thesis, Lifestyle, Heart Disease and the British Public, circa 1950 to circa 2000. And now we have Gregory John Hartwell for his thesis, Understanding Influences on the Attendance of Dual Users of Tobacco and E-Cigarettes at NHS Stop Smoking Services. And now Laurie Lynn McDougall for her thesis, Do Advocacy Networks and Communication Campaigns Influence Political Attention to Women's and Children's Health? Next we have Amy Jean Peterson for her thesis, Effects of the School Environment on Adolescent Sexual Behaviour, a mixed methods assessment of the theory of human functioning and school organisation. And now we have Patrice Alicia Rabatuthuli, primary care physician's knowledge of attitudes towards and practices in sexual health care of patients in middle and old age. Next, we have Lee Soon for her thesis, Economics of Breast Cancer Screening, Genetic Testing and Treatment. Next, we have Sedona Sweeney with her thesis, Improving the Estimation of Patient Costs Due to TB. And finally, and certainly last but not least, Mateusz Zygmunt Zatonski for his thesis, State, Society and the Politics of Smoking in Poland during and after Communism, 1960 to 2000. And that concludes the awards to PhD graduates from the Faculty of Public Health and Policy.
Ladies and gentlemen, the rite of passage that celebrates the academic achievements of this amazing group of students and underlines their transition to alumni is drawing to a close. The mission of our school is to improve health and health equity in the UK and worldwide, working in partnership to achieve excellence in public and global health research, education, and translation of knowledge into policy and practice. A particularly important part of the way that mission is realised and lives on is through the work, passion, and integrity of our school's alumni, sometimes in high-profile roles, other times in less visible but still vital ways, sometimes in overtly public health or global health contexts, other times in less obviously connected contexts. Each person whose academic achievements have been celebrated here today will find a different path onwards from studying at our school and will find different ways to contribute to the world. You will benefit from the formal and informal learning you have had during your time at our school, and also from the social and interpersonal learning within our vibrant, diverse community. During your time here, you will have started building and strengthening your personal and professional networks. You must continue to nurture these as you develop your careers. Please support one another to continue to use your expertise with passion and integrity to make a difference in the world. And do please keep in touch. We love to hear what our alumni do after they leave. We hope to see at least some of you back at the school in the future or joining our worldwide online learning community, pursuing further study as part of your continuing professional development. It is now my pleasure to close the ceremony by inviting you all back to Keppel Street for a celebration with light refreshments. Please ensure you bring your coloured reception ticket back to Keppel Street. Your reception location is indicated on this, and you will need it to gain attendance. To gain entrance. You can return your gown at Keppel Street, and there will be staff on hand to direct you. Thank you for coming to share in today's celebration. Please stand for the academic recession.